Hello folks, welcome to another episode of Aesthetic Medicine Minute. Today, March 8th, 2024, we're talking about something that's been making waves in our field, the use of platelet-rich plasma, or PRP, for hair restoration and skin rejuvenation. Now, PRP is not new on the block, but it sure is trendy. We're seeing a lot of interest due to its potential in improving skin texture and hair density. But here's the thing. While we know it has benefits, experts say there's a need for a standardized approach. Researchers and professionals across the board, they're recognizing the value of PRP. It's known to release growth factors that help to heal and regenerate tissues, which is quite the powerhouse for both skin and hair issues. That means for folks struggling with hair thinning or skin that's lost its pep, PRP could be the hero they've been looking for. However, with every hero comes a challenge. When it comes to PRP, the challenge is consensus. Currently, there's a lot of variation in how PRP is prepared and applied. And for us in the medical community, best practice is our mantra. We want to use methods that are backed by solid evidence and which offer safety and predictable results for patients. So, what's the call to action? It's simple. More research and development of standardized PRP protocols. This way, we ensure that anyone who walks into a clinic for PRP walks out with what we can confidently call the gold standard of treatment. Here at Anti-Aging Medical and Laser Clinic, we're all about those 5 pillars: safety, customized treatments, expertise, natural results, and enjoyable experiences. That's why we're keeping a close eye on the evolution of PRP standards. For now, that's the minute in aesthetic medicine. If PRP has piqued your interest, or if you just want to chat about options for hair and skin rejuvenation, my door is always open. This is Dr. Teri Fisher, reminding you that with a little science and artistry, we're sculpting confidence one treatment at a time. See you next time.